Hello and welcome to the Scaling Sleep Solutions show. I'm your host, David Odenyo. I'm part of a company that does sleep tech staffing for sleep practices here in Maryland for the last couple decades. And what the show is all about is sharing solutions for sleep practices to, in this current time with a lot of disruptive technology, figure out how to adapt and how to thrive in the future of sleep healthcare. And today I have a guest who is all about that, who I'm really excited to talk with. He's the founder of a company who is doing just that, helping sleep practices adapt and adopt new technologies so that they could scale their practice, but also what we're all in this business for, improve patient outcomes. So I'm glad to have you on the show, Joe Womack. How are you doing today?
I'm doing great, David. It was a pleasure to be with you a few months ago there in Baltimore. I think where did we go to the National Mall? But always a pleasure. I love your advocacy and your work on behalf of patients. That's really our goal. Our company's name is Integrative Health 2.0. And we believe the time's never been better to take a really patient first collaborative approach to this challenge.
Awesome, awesome. And yeah, it's been great to get to know you and hear about what you all are doing with IH2. And so just curious for people who may not know you, can you tell us a little bit about yourself and kind of how you got started on this mission of helping to improve patient outcomes and kind of ushering in the future of sleep technology?
Well, thank you, David. I my first career was in high tech, but I was blessed about a decade ago to start a company. We met a wonderful doctor, uh, David Singh, was a real leader in really working on oral appliance therapy and the options that are available. He wrote a really important paper at the University of Michigan in 2002 called Spatial Matrix Hypothesis. And Dr. Singh had actually done a lot of work with cleft palate children in the UK. And then he really started discovering, he wrote a book that a lot of dentists are aware of and a lot of medical professionals about 15 years ago called Epigenetic Orthodontics. And really the opportunity to really recognize that no matter what people had been through, whatever their journey was genetically and epigenetically, there was a lot of opportunity to do some healing even late in life, a lot of things that hadn't been taught in medical school and dental school up until that point. So we started a company to help dentists. And I'm really excited about how far oral appliance therapy has come in the last 10 years. But one of the biggest challenges for solving obstructive sleep apnea and solving sleep disordered breathing is we believe it takes a real collaborative approach. We believe that sleep doctors have to work with all of the other disciplines, and particularly world-class sleep dentists, to really provide a patient all the options. The goal of our company is 100% of patients know 100% of their options.
Mm. Yeah, no, that's awesome. And so I'm curious, is there anything that personally got you interested in invested out of all the things you could do? Was there a personal connection with the mission that got you interested in it?
Well, I've always been curious about the whole idea of snoring. And then as I've met a lot of people and wondering, Dr. Felix Liao right there in your neighborhood, and I know you've met Felix,
Mm.
but Dr. Liao, who's written about 5 books, the most famous one in the medical and dental community is 6 Foot Tiger, 3 Foot Cage. But so many stories like his, David. He came over here from Taiwan as a 16-year-old and he studied engineering. And as you know, he's got kind of an engineer's outlook. He's the vice president of the American Sleeping Sleep and Breathing Academy. But he started wondering when he went to dental school, why would the body grind down its hardest tissue? Like what is nocturnal bruxism all about? And there's so many journeys like that. And so as I started learning about this, I realized it kind of fell through the cracks. I mean, we had some good innovation that saved lives called the CPAP, and the BiPAP, and we love the work Dr. Bill Noah is doing out of Nashville with the newly approved FDA solution, the KPAP. And we know that Genio has recently been approved to give an alternative for surgery. But it seemed like uh, an invasive, relatively invasive surgery, which really is only suited for a few of the patients, or CPAP and now KPAP will prescribe 3 million CPAPs this year. Actually, will prescribe more than that. 3 million people will start on the journey. But what hit me, David, is how many people my age won't wear the CPAP, or they're intolerant, or they're claustrophobic. And so unfortunately, I've lost friends. I've had people who said, I'm not going to wear the CPAP. What's the big deal snoring? If my wife keeps complaining that I'm snoring too much, I'll just sleep in the other room. We've been married 40 years. I mean, I'm not gonna sit here and go start wearing a CPAP. So what's interesting is over the last 10 years, some amazing sleep, they're rare, but some amazing sleep dentists have done some really, really outstanding work with providing a third alternative to pressure and surgery. And that's through oral appliance therapy. And we've learned that it's really about the therapist. It's like any great doctor, it's what is the quality of the therapist, even more than the oral appliance. But I was just seeking a solution for even the limited alternatives we have, people weren't using. So, and yet it seemed like we were in the typical divide where a lot of great doctors knew some solutions, some part of the answer, but very siloed.
Yeah. And it's funny that you brought up Dr. Liao because I have his book right here. And he was kind of where I started this journey as well, which is kind of also how we connected. But yeah, from what you're saying, in my experience as a sleep tech and the techs who I've spoken with, exactly what you're saying. The CPAP is a great technology that's helped so many people, but there are a lot of patients who are, you could say, fall through the cracks, who, for whatever reason, the CPAP, it's not the right time for them, or they're not, it just doesn't work for them. They're claustrophobic. They don't see why they need to do it. So there are a lot of patients who, all throughout the industry, it's known that that's a really big challenge. So I'm curious if you could tell us a little bit about IH2's approach, a little bit more about how you all are creating that collaboration between sleep practices, dentists, and other practitioners.
Thank you. Yeah, our view, David, is we almost have two healthcare systems. We've got a healthcare system that, by definition, does medical necessity. That's the insurance, whether it's private or public insurance. Um, Decisions on what gets done, the procedures, really the symptom management, anything we do in healthcare kind of fits through an insurance point of view of really the healthcare is really what's the minimal medical necessity that is justified to be paid for. And that's a $6 trillion healthcare system. And it serves us extremely well. Thank God for it. Both of my children were born through in vitro fertilization. So the miracle of God and the miracle of unbelievable doctors. So we think that's a great healthcare system. But what's really growing very, very fast in this country is what McKinsey would call the health and wellness segment. That is patients being more educated than ever, even before AI, even before COVID, and really doing more about their own health, especially your generation. And people are saying, hey, I'm going to prioritize this. I'm going to look at what I think's good for me, what I've heard. Somebody's referred this solution to me for health and wellness, whether it's nutrition and exercise. There's a lot of solutions, whether it's chiropractic care, whether it's going to a sleep dentist, even though it's going to be a private pay oral appliance therapy. So that much smaller segment of the healthcare system, about 500 billion is what McKinsey estimates it to be, has some great answers too. So our approach is we want to have a patient first approach to wellness. What is the best thing for the patient first? We'll get to what the guys with the actuarial tables say secondarily,
Mm.
as opposed to before we consider anything, um, have the insurance company said it was okay and to what extent and to who and to where and when, et cetera. So patient first is the driver of our company. Um, but it's got to be collaborative. We believe sleeping and airway, it involves cardiologists, it involves neurologists, it involves pulmonologists, it involves great sleep dentists, it involves chiropractors, it involves myofunctional therapists. We're finding that this is a really such an important core part of health. I will tell you, you're more educated in this area. A lot of people I meet hadn't even heard of the glymphatic system during sleep. It was a lymph node. No, no, no. We're not talking about the lymphatic system. We're talking about the glymphatic system. So I think there's amazing discoveries every day in science, especially quantum biology and some of these other fields. So we want patients to have, as we say, 100% of the wellness options that are available to them. And then there are great companies like Cherry who have great payment plans. There are a lot of solutions for patients that didn't exist. There's a lot more knowledge about patients. We have some great work being done with co-therapies. We know sleep dentists who work well with chiropractors, who work really well with ENTs, et cetera. But what we haven't seen is that this was kind of formalized in a way for everybody to get paid for their services on behalf of the patient. And so, really, a more collaborative approach is why IH2 was created.
Yeah. And so, that reminds me of something I've heard from Clayton Christensen, who talked a lot about how healthcare, from his own personal experiences, had a lot of challenges going through the healthcare system, um, and talked about how a collaborative approach in the future would be what would, in his words, cure the healthcare system. So about this collaborative approach, interested in hearing more about how you guys, or even what do you think are some of the obstacles which have stopped a more collaborative approach, which makes what you guys are doing unique.
Well, I think education is the biggest thing. When I look at the healthy airway, um, and what is taught in most medical schools and what's taught in most dental schools. I think in Western medicine, we have an added challenge because we kind of separate a lot of the parts of the body, a lot of the view on the medical side from really what goes on in dentistry, and for good reason. Dentistry's complex in and of itself, just to work on the mid face. And so I think just the way we've developed in our healthcare system has been a challenge. And then I think sometimes insurance looks at things very much as a process, as a procedure, I should say, and a lot of times systems management. And so there's not as much insurance flexibility toward health and wellness things that avoid medical necessity down the road. So part of it's how we've developed. Part of it is just the fact that medicine, the medical doctors and the dentists have kind of been down their own tracks. And then even when I talk to some of the leading neurologists, they look at a lot of medical doctors really have to specialize and become really good in a specific area of the body. And yet sleep and breathing, they say that, you can go 4 weeks without food, uh, what is it, 4 days without water and 4 minutes without breath. So I think we're really in a fantastic time to have everybody realize how important sleep is, how important breathing is. And so our approach is to take, I'll give you an example. We're working with a neurologist, pretty well known. He's on the UT Southwest teaching hospital faculty for decades. So Dr. Baroki takes the approach that once we've looked at a sleep uh, uh, candidate, a sleep test that's mild, moderate, or severe sleep apnea, now we kind of consider is a surgery the best option, or is airway pressure the best option, or is this a candidate for some oral appliance therapy that could lead to broader and more extended wellness over time. And kind of our innovation is that neurologist works with a world-class ENT, a great surgeon in Dallas, also works with a sleep uh, dentist, also has a dental radiology look at the airway scan. And all of this happens right in the Southwestern Neuroscience Institute. So the more we can pull everything together, the patient goes to their primary care physician, the patient experiences a team collaboratively having a single treatment plan, as opposed to, hey, the ENT said we can help a little bit with allergies here, or different aspects of the healthcare system, you know, solving one aspect of it. It's oftentimes, as you know, in sleep and particularly breathing, it's a multitude of factors. Each person has their own journey, and that's physically and mentally and psychologically, and lots of epigenetic journeys that have occurred just beyond how we were born and what our unique genetic blueprint is. So having a collaborative team of the best, we think gets the best patient outcome over the long haul, really toward wellness, beyond just surviving, but really starting to thrive.
Yeah. And it gets to the first word in your company's name, which is integrative, really integrating the different aspects of this, which yeah, once again, from my experience, I've seen that it could be a challenging journey, a challenging patient journey, just even understanding what's going on. You get sent to a referral, and then there's drop-offs there. Um, yeah, so it's a very unique. I noticed that that was a unique aspect of your company's approach. But so I'm curious for a practice who would be, let's say, a sleep practice that's interested in kind of hearing more. They're kind of forward thinking. They want to make sure that they're adapting and that they're creating the best opportunity for better patient outcomes. What could be some next steps if they were interested in hearing more?
Well, I appreciate that question, of course, David. IH2 airwaywellness.com is an easy way to just kind of fill that out. IH2 airwaywellness.com. So anybody can go on there and we'll follow up with them and talk about it. Now, one of the things that I would just, kind of make clear, one of the challenges of our company, which everybody in medicine knows, or in dentistry knows, or in chiropractic care knows, is that there's a lot of regulatory environment. Every state is different. So that's a lot of the value we add in navigating this to where everybody can collaboratively do what they do best and work together and be able to put the patient first. But IH2 airwaywellness.com is a way. Also, I'm passionate about this. My children are grown. My cell phone number is 214 223 9907. And I think you can tell your viewers that I'm going to answer anytime because this is a real passion of mine. I think there's a lot of good work to be done, but we've got to do it together.
Yeah, definitely, definitely. You're one of the most responsive people that's what I've noticed. Um, so yeah, and then another thing that some people in or practices in Maryland would be specifically interested in is that we'll be meeting at the sleep conference in right about 4 weeks here. It's coming really soon. So yeah, it would be awesome. What would maybe a practice in Maryland, where would they be able to find you or get in touch
Well,
with you at the conference?
will reach out to me. And if you, by the way, tell Samuel I said hello.
Yeah.
Um, but if you guys can set up some meetings, I'd love to set up some meetings. We've got an amazing ENT from Dallas, Dr. Jeff West. And he's worked collaboratively. In fact, they've created a curriculum together, and it's really just outstanding. The slides are pretty intertwined between how important stage three sleep is and what are the things that a sleep dentist sees. But Dr. Mark Musso, now he'll be there Monday of the conference. Dr. Jeff West will be there all week. So we'll have a sleep dentist and an ENT there that have done at least 1,000 patients together collaboratively over the last 10 years, and they've had outstanding results, better than either of them would have had by themselves. And in fact, have a curriculum. They teach doctors and dentists collectively in Dallas Fort Worth already. And I've told them that you might have um, some of the folks you work with want to meet with them and hear their experience and how they've been able to integrate that and put the patient first. And we're excited about being out there for that conference for sure.
Yeah, likewise, likewise. So yeah. Yeah, Joe, I know you have a flight to make it to over there. So it's been great chatting with you, and it's been great also just getting to know you and kind of hear about the mission that you guys are on at IH2. So to
I,
all
I'm going
yeah.
to tell you one other thing because I don't always say this, but
Mhm.
when you ask about the mission, I've been interested in this for 10 years, and about a year ago, I woke up literally in the middle of the night and I had opened up my Bible because I wanted to see what God said in Genesis 2:7 about breathing life into Adam's nostrils. I just think it's unbelievable how much we miss on how important nasal breathing is versus mouth breathing. I think you know that, but there's so many benefits that patients need to understand just by good breathing hygiene. So I'm excited to have us kind of spread the word on that. Just
Yeah.
basic fundamental. Before you ever see a doctor, if you're just conscious about becoming a nasal breather.
Yeah. Yeah, and that's to use a pun. I know you're a fan of puns. It was very inspiring when you shared that scripture with me. And yeah, it really is getting back to what that showed me. It really is getting back to the original our original design. So yeah, I'm
Well,
glad you shared that there.
Well, and if you look at some of the unbelievable sleep dentists that have emerged, and they're not anything like you think of a dentist typically. These people have done, a lot of them are biologic dentists, but they've done so much research, so much awareness, and are willing to work with patients so collaboratively they make a difference. So, as you know, Dr. Felix Liao, if you go in to see him, before he ever looks in your mouth, you think you're at a chiropractor's office, the way, checks your skeletal outlook and all that, knowing that this is literally the top of our skeleton. And great chiropractors look at that. And so Dr. Liao talks about, he talks about not only breathing, but circulation, digestion, energy, sleep, alignment, what's your body alignment. And so as people are looking more at the skeleton and how the maxilla and mandible, and this goes back to some of the great work from Dr. Singh, adjunct professor at Stanford. There's just so much more awareness now. We've just got to get the word out. And guys like you doing what you do, David, that's you're making a difference, and we're grateful for it.
Yeah, I appreciate it. I'm grateful to be on the mission with you. And so, yeah, it's great to chat. And to all of you who joined us, glad to have you here. Once again, like Joe mentioned, you could go to IH2airwaywellness.com, correct?
Yes, sir. And
Yeah,
214-223-9907. Happy to get you pointed in the right direction and get you collaborating. And let's make the patient journey as easy, complete, and a collaborative solution as we possibly can.
awesome, awesome. And I'll link that at the bottom for people as well. Joe, great chatting with you. Looking
We will
forward to meeting
see,
at Sleep
we'll
2026.
see, we'll see you in 4 weeks, brother.
Yeah, definitely. All right, take care, everyone.
Take care. Thank you all. Appreciate it.